fine. Welcome to the New South Wales Health Statewide Biobank seminar. I want to acknowledge that the Statewide Biobank is built on the land of the Gadigal people of the Eora Nation here in Camperdown in Sydney. And I want to acknowledge the elders past, present and emerging, and that this has always been the site of teaching, learning and healing. So long before the Statewide Biobank was established. It's a great pleasure to welcome our speaker for today, who is Professor Zanfina Ademi. And so Zanfina joins us from Monash University in Melbourne. So she is Professor of Health Economics there, and she's also head of the Health Economics and Policy Evaluation Research Group. So she leads a multidisciplinary team of expertise, including health economists, epidemiologists, pharmacists, with the aim to advance health and equity with evidence. So she's had a number of previous roles. She's worked in the field of health technology assessment with the Swiss Medical Board and Switzerland's Federal Office of Public Health. And her research has informed policy and attracted substantial amounts of funding from the NHMRC and from MRFF. So today, Zanfina is going to be talking to us about a project that she led that analyses the return on investments at a particular biobank, and that's the Victorian Cancer Biobank based in Melbourne. So this question of return on investment in biobanking is very important because, of course, we all know that biobanking is an expensive activity. It does require investments, often in the form of public funds. And so it's quite normal for stakeholders to be interested in what kinds of returns these investments make. So Zanfina, thank you again for your willingness to speak to us, and we're very interested to learn about the results of your study. Thank you.
Thanks, Jennifer. Good afternoon, everyone, and thank you for having me. I really enjoyed working on this project because, as Jennifer pointed out, a lot of people are interested because we use public health funding, but also it was quite challenging to work on this project because things are not as straightforward when we evaluate a particular drug or a particular technology. This has a much more broader impact. So before I start my talk, I just wanted to highlight some of the conflict of interest. I'm a member of Economic Subcommittee of the Australia's Pharmaceutical Benefit Advisory Committee. And I'm also a core member of the Lipoprotein A International Task Force and a member of the Professional Advisory Board of FH Australia. So what I thought to cover today was some of the key challenges in health economic evaluation of registries and biobanks, and how challenging it is to actually find the right comparator and how to compare it and make sure that the outcomes that we are generating are fit for purpose. And I'm also going to show you the results of return on investment of analysis of the Victorian Cancer Biobank based on societal impact, so gains in human health and well-being looked in a form of the return on investment. So before I start, I just thought to highlight why we do this kind of analysis and why it's important to do this kind of analysis. First of all, we know that, and Jennifer pointed out, all activities that we do in healthcare are expensive, and we want to know if it's affordable to do them. And this is mainly because rising costs driven by both volume and aging of population, and we have a lot of expensive technologies at the moment. And not all the technologies that we have in our healthcare are effective. Some might be effective, but some of them might not be cost effective. And some of them might be cost effective in Australia, but not cost effective in other countries. So it's always important to do these exercises based on a country where we live. And our goal is always to improve safety, quality, and efficiency of our healthcare with a patient-centered healthcare focus. So I thought to bring some of the key challenges on evaluating registries and biobanks, because this is something that we have focused in the last couple of years. Rather than just evaluating single technologies, we've been looking at importance of some of these funding schemes that the government has funding, and how have they had an impact on return on investment. Every dollars that government invested, how many dollars have been returned due to this economic impact. So some of the key challenges that we have faced is a lack of suitable comparator. So when you do a registry and biobank, obviously you don't have a comparator. You have a group that does a thing, but then how do you compare that had an impact? Effects difficult to isolate from broader system changes, because they not only impact the outcome, but they might impact the broader society. Long-term benefits spread across large, undefined population, and those benefits might take 100 years, 30 years, 40 years, and these are some of the challenges that I would like to highlight today. And complexity in attributing health outcomes to biobank activities. Is it just biobank, or is it other things that we have to consider? And outputs are very diverse, so can be publication, can be how many staffs you trained, how many PhDs have been trained, master students, and so forth. So I thought to bring some of the 3 examples that we've done so far before I go into the Victorian Cancer Biobank. So one of the studies that has looked at the impact or economic evaluation of registries has been at School of Public Health, where they looked at the all New Zealand acute coronary syndromes quality improvement registry program, effectiveness and costs of this program in each year over 4 years, compared to hypothetical scenario when registry did not exist. So what this study showed that this all New Zealand and acute coronary quality improvement program improved or contributed to 15% of temporal change in patient mortality and hospital readmission. So this is one example. Another example, this didn't have a direct comparator. So temporal changes that were observed over the years were assumed to apply to the changes or trends over the years. Another example is the Swedish National Guideline for Acute Myocardial Infarction Quality Improvement Coronary Care Study, which found that this was a cost-effective way, but the way how they found the comparator is that some of the hospitals were not part of this quality improvement. So then based on that, the comparator was selected in that way. Another one that I worked myself was the economic evaluation of community benefits of Australian pregnancy registry for anti-seizure medication. So basically we looked at the impact of the Royal Wallenberg Australian Pregnancy Register, which was established to collect and analyze and publish data on risk of babies exposed to anti-seizure medications. And a lot of those challenges or a lot of the guidelines that have come because of this registry. For example, valproic acid not to be used in women who are pregnant due to risk of babies exposed to those medication. And we wanted to understand what kind of a societal impact this registry had over 20 years period. So we estimated effectiveness of this registry over a 20-year period. The comparator was set adverse pregnancy outcomes that was collected in the first 2-3 years, and then that was kept constant. And then we looked at the improvement that the registry delivered over the 20-year period time. So over this 20 years time horizon, the return on investment from the Australian Pregnancy Registry from a societal perspective was return on investment was around 2000, which was quite a lot. that every dollar spent on this program resulted in around $2,000 return. The reason was that this registry was getting from the government $800,000 per year. So it was quite a little amount of funding that they were getting for the benefits that pregnant women or society were receiving due to this registry. And over this time, within this registry, it was estimated that 9,600 adverse pregnancy outcomes were avoided and reduced around 191 million in terms of the health care, but the societal benefits were quite huge. They were around 9 billion. So this study generated quite a lot of media input to understand the impact of registries and potentially biobanks can have on society and the well-being. So I'm just illustrating some of these examples to understand that how challenging sometimes is to measure the impact, but also how good is to show then the impact that these registries of biobanks can have at the population level. Another study who did a systematic review has shown that clinical quality registries were cost effective across different countries. So this is a now well-established method to show that we can actually look at the economic evaluation of registries and potentially biobanks. So how can we enhance biobank sustainability? So sustainability can be strengthened by undertaking biobanks' broader economic and societal benefits. And obviously this can be done by applying economic criteria and analytical tools, supports effective and monitoring of evaluation of biobank activities, and using quality metrics for inputs and outputs and impacts of essential for assessing the biobank performance. And in this instance, those metrics of inputs and outputs were looked from a health economic perspective. So that's why health economic analyses are used to measure cost and effectiveness and efficiency and consumptions of healthcare. So probably you are familiar, there are different ways how you can assess a technology or how you can assess registry impact or biobank. It can be cost utility analysis and cost effectiveness analysis. Usually when we assess technologies such as drugs or surgery, we tend to use cost utility and cost effectiveness analysis. So net cost, net changes in years of life lived, or net cost changes in quality adjusted life years. So this is a question, how much we are willing to pay for one quality adjusted life year outcome generated or 1 year of life lived. But in our instance, when we look at the registries or biobanks, I think the question is more about cost benefit analysis. So the question is how much investment we've given and how much net societal benefits we have generated because of this investment. So that's why in assessing the Victorian Cancer Biobank, we have decided to look at the cost benefit analysis rather than cost effectiveness or cost utility analysis. So project overview is that the main aim of the project was to capture the broader economic benefit of Victorian Cancer Biobank via its contribution to research and innovation in biomedical field. You can see here that we are very specific, innovation in biomedical field, and the reason why we've done this, I'm going to highlight it later. It's because some of the issues we had to quantify other outcomes, because we know that biobanks have much more larger outcomes rather than just in biomedical field. But this was the only way at this point in time we could quantify the impact. So the specific project goals were to conduct a return on investment on the Victorian Cancer Biobank based on social impact. So the social impacts are gains in human health and well-being. Just to give you a bit of background, probably you are very familiar with this, that the Victorian Cancer Biobank was the consortium formed in 2006, one of the largest cancer biobanks in Australia. When I made these slides, more than 300 academic and commercial projects were supported at that time. 3,000 donors have participated and over 465 specimens were collected. So consortium, it's a biobank across Melbourne. It's in metropolitan area, so it's quite near the major hospitals such as Royal Melbourne Hospital, Peter Mac, Austin, Eastern Health, and Monash Health. So what kind of methods we used to conduct the return on investment to assess the impact of the Victorian Cancer Biobank? So we've used the return on investment analysis of the Victorian Cancer Biobank based on social impact. Methods derived from the literature and use the Deloitte Access return on investment that was done for an NHMRC investment report. So what did we do first? First, we compared the current and future burden of disability adjusted life years. I'm going to explain what is disability adjusted life years in Australia. And then we calculate the percentage of burden improvements attributed to Victorian Cancer Biobank. Then we quantify the societal value of health improvements, and societal value of health improvements, Australian government uses the value of statistical life, and then define the total investment that Victorian Cancer Biobank has received from the government and investors, and then we calculate the return on investment. So the key concept before I report the results for you is to understand that the gains in health were captured through disability adjusted life years. So the reason why we've chosen disability adjusted life years is that global burden of disease provide this metric information across all countries. Because then we have to disentangle the impact of disability adjusted life years that had on improvement on cancer and other diseases in comparison between Australia and other countries. And this is the only way we were able to do that. So disability adjusted life years is years lived with disability plus years of life lost. And this is one of the most common metrics which is used in global burden of disease to fund especially low and middle income countries based on the burden of disease. So it's quite common metric that's used in epidemiology and health economics. So it's important for you to understand how the structure of the projects went. So in 2006, as mentioned, Victorian Cancer Biobank initial funding, and the period of scientific production was looked only from 2006 until 2024. So basically that was the time that we look at the scientific production of Victorian Cancer Biobank that were related to VCB. Then we had a time lag from 2026 and 2046. So we didn't measure any scientific production or costs in terms of the VCB. And then the evaluation period actually looked at from 2046 until 2066, what is the research impact that VCP can have on society. So the end of evaluation was in 2066. But also for you, it's important to understand that this is a 20-year period. So it was a 20-year lag, but then 20-year period of benefits. But we did scenario analysis where we did a 40 years impact and 30 years impact. But the base case analysis, to be more conservative when we present results to the government, we've used an evaluation period of 20 years. So the impact of scientific research on health improvements attributed to the Victorian Cancer Biobank. So this was the key assumption that we've made in analysis. Impact of research on human improvement. So global estimates show that 1/3 of health gains are attributed to research-driven treatment and advances. The remaining 2/3 come prevention and behavior changes. So in cancer-specific analysis, it's suggested that it's around 50 to 60% of mortality and health improvements arise due to research innovations such as cancer biobanks. But for this evaluation, we wanted to be conservative, and we made an assumption that 33% of all research-driven treatment advances are due to Victorian Cancer Biobank. So the first step was to compare the current and future burden of cancers in Australia. As pointed out, we have used an established metric, which is disability-adjusted life years. So this is the disability-adjusted life years, global burden of the disease data. You can see that from year 2000 to year 260, we have this data, and from 2020, we have this data, and then data projections were done to 2,600 based on what we observed in the previous years. So then expected decrease in DALYs, which means increase in health, or DALYs saved, were calculated. So you can see here that from 2020, if no intervention was produced in the world, then these are the current DALYs, and they should probably stay the same. But because different innovations are happening at the same time, including cancers, then we project that those changes are due to new innovations. So this is the method that we have used to calculate the burden of improvement of the VCB. You can see that it's quite little. So first of all, we have looked at DALYs saved. As mentioned before, this is 100%, the first blue and orange. So global biomedical research impacts is 30%. Other factors such as prevention or other ways of changing contributes to 67%. So we've assumed 33% of biomedical research that is published relates to the DALYs saved. And then we have looked all across scientific publication from other countries, contribute 97%. Australia contribute only 2.3%. And of this 2.3%, scientific contribution not associated with VCB, meaning that 98.8% was not associated with the VCB, only 1.2% of all those scientific contribution was associated with VCB. So Australia produces quite a lot of research, but when you look at globally, it's only 2.3%. And of that 2.3%, 98% is due to other things that happened in Australia, and only 1.2% is due to the VCB, Victorian Cancer Biobank. So this is projected DALYs saved attributable to cancer in Australia in 2026 and 66. So total DALYs attributed to cancer, it's in blue. And then DALYs saved attributable to cancer research globally. And then this orange one now goes in down. DALYs attributed in Australia. You can see here this sort of a green line, which is very little in here. And this green line is assumed, and you can see that DALYs attributed to Australian medical research is in green, but in red or purple, DALYs attributed to the VCB. You can see here, you barely can see it, it's only 1.2%. So the associated with the peer review publication. So as pointed out, we've used a very established method to translate DALYs saved into a cost outcome. In Australia, governments use willingness to pay threshold for every years of life saved. government is willing to pay around $200,000. So then we calculated the return on investment. So how do you calculate the return on investment? Was calculated as the total health value generated. So we looked at those DALYs saved. And that DALY saved was every DALY saved was multiplied by the value of statistical life minus the total investment cost, how much the Victorian Cancer Biobank has received investment, divided by the total cost of investment. So this is the first analysis that I would like to show. So total investment that Victorian Cancer Biobank has received was around 32 million. And the DALY saved, which was only due to the Victorian Cancer Biobank associated research, was 373. Then when this 373 was multiplied by 227, the total value gain was around 84 million. Going back to the formula here, so total value of savings gained due to the biomedical research from the Victorian Cancer Biobank, investment that Victorian Cancer Biobank has received divided by investment, it gives you a return on investment of 1.59. So what does this mean? It means that for every dollar that the government has invested on Victorian Cancer Biobank, it returned 1.59. Because this is positive, it means that it has saved costs. When you have a return on investment negative, it means that it actually didn't save cost, it increased the cost of a healthcare. So this is the base case where we assumed a discount rate of 3% because things when happen in the future, we have to discount as per the economic principle, because what is valued today, it's not valued in 20 or 40 years' time. Also here you have to remember that we have assumed that only 33% of biomedical research that is produced and published at that particular period of time that we have assessed was 33%. Remember on the slide that I said, other papers or publications have assumed 50% in the cancer research. So when we look at different scenario analysis where we have looked at 30-year benefit from 2036 and 66, the return on investment increased, so the savings increased. So instead of being 159, it was 2.67. When we looked at 40 years period, of course, the return on investment increased by double, 350. And then biomedical research, as we said, it was 33%. Now we make the biomedical research impact on health would be 50%. And of course, the return on investment from 159 increased to 2.93. In our analysis, we've used a discount rate of 3%. And sometimes in those analysis, people think that 3% discount rate is quite a lot. And in scenario, we've used 1.5 discount rate. So the return on investment in this case has improved further. So I just wanted to put this in the context. What does this mean? Where the return on investment for Victorian Cancer Biobank compares to some of the other research and funded. For example, the Deloitte Access report that was produced said that based on the funding that NHMRC has allocated over the years, and they've assumed actually 50% attribution to research over 40 years, a return on investment was 2. So it's quite close to NHMRC, but if we would assume a 50% attribution, our return on investment for VCB would be much more higher, 2.93. So let's look at some of the NIH-funded research. It was around 2.21, quite similar to ours. Other infrastructure in Australia was 1.2. And other infrastructure federal investment in US was 1.17. So you can see that the return on investment that we have generated, it's quite similar, or I would say better, to some of the other research that has published so far. So some of the discussion points that I would like to highlight, and I think for us that we are here in our call and for us that do research on biobanks, what are some of the key things that we would like to improve? So then when we do another economic evaluation of such kind, we would be better placed to actually capture a larger benefit of the society. So you've seen here that the attribution of benefits of publication associated with VCB, with other funding sources, and we've also assumed that same impact on cancer burden for every publication, which in reality might not be true. So why VCB operating model is an exemplar, and how can it serve to other operating models across Australia and globally to generate potentially a better outcomes when we would do this kind of evaluation. So it's a consortium model, accelerated biospecimen collection, enabling rapid accumulation of samples, critical for studying rare cancer, where delays could slow innovation for years. So we know here that we are improving innovation, but sometimes it's very difficult to capture that innovation in such analysis. Homogeneous quality control across the sites, ensure consistency, high quality specimens for researchers. And its open access model promotes equitable research opportunity, allowing broad, fair access to biospecimens and supporting diverse scientific inquiry. Collectively, these features position, obviously, Victorian Cancer Biobank as a model for high quality, scalable research infrastructure. So these are some of the key limitations that I wanted to highlight and potentially would help other biobanks who are in a position to conduct such analysis. So evaluation captured Victorian Cancer Biobank's health impact based only on available data, and we made several assumptions. So the main limitation was commercial impacts were excluded due to lack of robust methods to quantify commercial outputs and to maintain a conservative approach. Indirect research costs could not be measured, such as trial staffing, lab operation. Although these may be substantial and are difficult to accurately capture, I think this is something that every biobank should record very well. So then when we do this analysis, we will be able to include that in a return on investment. So return on investment was estimated from assumed correlation between publication outputs and improved healthcare following previously published method. So the gaps and future improvements, VCB tracks publication outputs, but several key parameters for economic evaluation are not routinely collected. So for example, funding spent on biospecimen, patients' outputs, monetary value of startups, and other commercial outputs, which can enable evaluation of commercial as well as the academic impact. We were not able to actually capture broader societal impact, such as looking at productivity and postgraduate training, were outside of the scope. But we believe that having such information would have made further increase in the Victorian Cancer Biobank overall value if those information were in hand for us to evaluate. Using publication volume as a metric may be sometimes problematic, as it does not fully capture publication quality. We've captured quantity, we haven't captured quality. Findings may not generalize to all settings, but the methodology offers an exemplar of biobank economic value. So with this, I would like to acknowledge the Victorian Cancer Agency for funding this research. This project was conducted as a part of Monash University under my leadership and two of my postdoc. I would like to mention Clara Marquina and Melanie Lloyd, and also the supporting staff, especially Sue Evans, which is the head of the Victorian Cancer Registry Division, Wayne and Jonas were detrimental for the success of the completion of this work. So if you are interested, this is the paper that is being published already. Some more granular details on it you can find in this publication. Now I'm opening for questions and discussion, and thank you very much.